The PRF, platelet-rich fibrin procedure, begins with drawing a small amount of the patient's blood, usually from the arm. This blood sample is immediately placed into a sterile PRF tube, without any anticoagulants or chemicals. The tube is then inserted into a specialized centrifuge and spun at a specific speed and time to separate the blood components. During this spinning process, the platelets, white blood cells, and fibrin concentrate into a gel-like layer called PRF. Once the centrifugation is complete, the PRF layer is carefully extracted from the tube using sterile tools. This PRF membrane, or clot, is rich in growth factors that promote tissue regeneration and healing. PRF can be used for gum healing, bone grafting, enhancing implant integration, accelerating wound healing, and promoting tissue regeneration.